Good afternoon, and my name is Ann Rains, and I'm going to be discussing about unvaccinated students, the hidden cost. Unvaccinated students in the public school system. Unvaccinated students in the public school system are not only a health risk to other children, but a risk to families' financial future and even to the children's educational future as a whole. Vaccination should be mandatory except for recognized religious and medical reasons. Personal beliefs or mere parents' preference should not be taken as a valid reason for not getting vaccinated. For the purpose of this presentation, there are three main reasons why vaccination should be mandated on a national and stringently applied. First, the cost to education. Second, the cost of insurance and hospitalization. And third, the possibility of an outbreak. Based on a journal article done by Upstream Public Health, Oregon, titled The Connection Between Missing School and Health, a review of chronic absenteeism and student health in Oregon. It's done by Henderson, 2014. Chronic absenteeism is defined as missing 10% or more of school days in a school year, for any reason, includes all absences, excused and unexcused. When unvaccinated children attend school, there is a risk that they would contract diseases. This leads to absences. Then absences lead to poor school performance. The cost of education missed by the child sometimes cannot be made up, and therefore the child will be behind in his or her classmates. Absenteeism may be avoided if supposed preventable illnesses are given more attention. In a study conducted by Baltimore Student Absence Campaign in 2012, students who are chronically absent from school are more likely to fall behind academically and sometimes permanently. The campaign also stated that the same students were also likely to have discipline and behavioral problems, which in turn may lead to suspension and ultimately expulsion or dropping out of school. Unfortunately, children not attending school due to constant illness lose interest in learning. Therefore, vaccinating the children could prevent the number of absences. When they miss less number of school days, they are less likely to drop out of school. This was noted in the same article from Upstream Public Health, Oregon. Aside from the cost to children's education, vaccinations would also prevent the high cost of medical bills. Hospitalization, aside from being a burden to the children, is also a load on the family's budget. Some hospitalization can actually be prevented if the children were vaccinated. When unvaccinated children get sick, the burden is on the family, not just the doctors or the hospital bills, but possibly loss of income because someone has to stay home with the sick child. For these reasons, all kids should be vaccinated to limit the financial burden on the family. When financial burdens become an issue in the families, most bills get unpaid. With the high cost of health insurance, this is usually one of the bills that lapse. With the high rise of people without insurance, this causes costs for those who do pay to go up and compensate for those who don't or are unable to. Based on the CDC Center for Disease Control press release in July 2016, measles cases and outbreaks in the recent months, CDC reports that 10 states have already declared illnesses that were supposedly to be prevented by vaccines. If children were vaccinated, measles outbreaks would be avoided. In 2015, the United States experienced another measles outbreak linked to an amusement park in California. In the same CDC data, measles spread in communities with groups of unvaccinated people. In conclusion, unvaccinated students in the public school system have its hidden costs to the child, to the family, and to the community. All children should be vaccinated to reduce the risk of costs, not just to the individual student, but to all.